Today's Health and Wellness Tuesday. You know how we do it. Today we're focusing on non-communicable diseases, NCDs. NCDs, also known as chronic diseases, are medical conditions that are not caused by infectious agents, but rather by a combination of genetic, environmental, and lifestyle factors. They are the leading cause of death and disability worldwide, killing more than 41 million people each year, and accounting for over 70% of all deaths globally. That's according to the World Health Organization. In Ghana, NCDs are increasingly becoming a major public health concern, with conditions such as hypertension, diabetes, heart disease, and cancer being among the top causes of death and disability. The rise of NCDs in Ghana is attributed to factors such as rapid urbanization, changes in diet and physical activity, and increasing life expectancy. Today, right here on Z in the Morning, we'll be discussing the burden of NCDs in Ghana, their risk factors, prevention, management, and treatment options, as well as the efforts being made to address this growing health concern. Listeners, we're privileged, like I told you from the very beginning. We are more than privileged to have right here in the studios of Z is Professor George Boateng. He's MD, PhD, consultant physician. He is an associate professor of medicine, molecular microbiology and virology, Noguchi Memorial Institute of Medical Research, University of Ghana, and also Washington University in St. Louis, USA. He's also the director of medical and scientific research at the UGMC, University of Ghana Medical Center, that is. It's important that we acknowledge the great man that is seated in our studios today. Thank you so much for finding time to help us with this important issue. Good morning, Prof.
Good morning. Thank you for inviting me.
It's an honor. We should be thankful that you finally found time, because we know you have a very busy schedule. And so to find time to come here, we are most privileged. So, non-communicable diseases as opposed to what? Communicable diseases?
Correct.
So if you could break down the two for us.
Yes. So normally when we talk about diseases, they are grouped into two broad categories. So communicable or infectious diseases are usually the ones that could be transmitted from one person to the other. So let's say you have the commonest one, I guess I can talk about it, let's say COVID, right? COVID was here a few years ago, and we were all running helter-skelter because it's communicable. One person has it, they cough, you can get it, right? So that is communicable diseases. Talk about HIV, talk about tuberculosis, all those are communicable diseases because one person having it can transmit it to the other person. Non-communicable diseases in general are diseases that cannot be transmitted from one person to the other. So you get it because, of lifestyle factors, because of, various factors like age, genetics, the way, you live your life in general. And they are usually very slow. And most of the time, people are not going to experience symptoms, unless they go for screening, right? So, for instance, hypertension or high blood pressure is the commonest non-communicable disease. And most people with high blood pressure will not experience any symptoms until it gets too bad, or until they have a stroke or heart attack or kidney failure. And then until they have a sudden death episode, and so that is why oftentimes in Ghana you see that we say that, oh, Bibian, or I saw him yesterday, there was nothing, and then today he's dead, right? And then we console ourselves with gone too soon, or painful.
What a shock!
What a shock! Painful exit. All those things, but. No death just happens just like that, right? So that person probably had high blood pressure that was uncontrolled. They did not know about it, and they did not, or even they knew about it. Some people just don't do anything about it. And then, one day the heart just stops. And if your heart stops in the middle of the night, that's it, you are gone. So that is the difference between communicable and non-communicable diseases. And non-communicable diseases are overtaking communicable diseases now. So In Ghana, it has already overtaken communicable disease in terms of causes of death. But in Africa in general, it's expected to overtake communicable disease by the year 2030, which is just a few years from now. So that is why it is so critical that we educate ourselves, educate the public, policymakers, make the right policies so that we can have a productive workforce.
What has been our approach to these two broad categorizations, and how can we do better if one is overtaking the other?
I think in our, there's something that we call a demographic transition, right? So where in general you have infectious diseases, and then as the population, the community develops, the infectious diseases go down. You have antibiotics, you have better sanitation. Something like malaria is mainly a sanitation problem, right? I mean, if countries have eliminated malaria because there is no gutters for the parasite, for the mosquito to breed, right? So if we fix those things, right? As we fix those things, then the communicable disease, the non-communicable disease become more prominent, right? That is the usual transition. The problem with Africa is that we are now in the midst of both. We have a double whammy where we have the infectious diseases are still here, and because of lifestyle changes, we've now added on the non-communicable disease. So we really are in some big trouble, right, when it comes to this, because malaria, TB, HIV are still here with us. And then now hypertension, heart disease, kidney disease, diabetes are also increasing at astronomical rates. So we really, really need to get our act together.
And for a continent or for a country, if we're talking Ghana, where your resources are very, they're not as they should be, it means that you are torn between, putting money in say the communicable ones, the infectious ones, because that one, it can wipe out the entire nation. Meanwhile, like you're saying, the non-communicable are increasing, but you don't have the resources to push it there.
Well, I'm one of those people who disagree that we don't have resources, So, in our scientific field, sometimes when we go for conferences, they call us resource limited settings, those of us in Africa, I think it's a matter of management and priorities, right? So if you want to have a healthy workforce, so think of it this way. Let's say you are a company, a government agency, whatever, Z Multimedia, whatever the company is, right? You have people who are 35, 40, very productive. Maybe the person is your producer or the high performer. That person can just get screened for high blood pressure for $0. They just go to the pharmacy nearby, and there's a pharmacy almost everywhere. Almost all of them will check your blood pressure for you for nothing, or if anything at all, less than 10 cedis, right? And that person will know that they have this, and it can be controlled, right? Now, if you as a corporate, entity or government, you don't do that, and then that person end up with very high blood pressure, they end up with a brain bleed. That person now ends up in the hospital. Millions of cedis could be spent. The person is now disabled. They end up in the house. The whole family is shattered. Breadwinner is gone. So it's not I don't think it's a matter of limited resources. It's a matter of we planning to say that, okay, this is a problem. We need to deal with it. How do we get everybody at the age of, say, 18 going to check their blood pressure every 2 or 3 years? That is the WHO recommendation. And from the age of 40 to check their blood pressure every year. How do we get everyone to do that? Okay, so that's what we need to think about. And it's not rocket science, and it's not going to be that difficult if we put, our heads together and look at what we already have, right? So you have, like in a lot of communities, they have these CHIP compounds, which are like the Ghana Health Service compounds where you can go for regular care. What if we empower the nurses, and the community health nurses to make screening for NCDs a priority, right?
Okay.
Even, as a government or as TUC or as associations, can we have like screening clinics in the markets? Can we have screening clinics in the, lorry stations? Can we? Because it doesn't take much. Screening for diabetes and hypertension doesn't really take much resources. Okay. And you don't need like a specialist doctor like me to sit there and do it. You can train a community health nurse, you can train somebody else who can actually do these screenings, So I think it's a matter of we knowing that, look, this is an issue. And then, we plan how to do it. I think we do have the resources, it's a matter of management.
Okay, so I was asking that because if you look at a typical community in a country, if heart disease were to be killing a lot more people, however, COVID comes and will not even kill half of those that heart disease kills, but the noise around the COVID or a common cold, a swine flu, something, the noise behind it is so large that resources that would have gone into. But you are saying that NCDs don't really need a lot for us to control them.
Yeah, and those are scary just because, we know we can transmit it, right? And,
exactly.
And therefore, we rightly so, we need to put together the measures to prevent people getting sick. But NCDs, again, they are slow. if you have high blood pressure, it's not going to kill you today, right? But it may kill you in 5 years' time. So in a way, you have time to get yourself checked. So it's not like COVID that, it hits and everybody's running helter-skelter, So it's a matter. So that's why it is also easier to plan for NCDs, right? Because it's not a sudden thing. It's something that we know is there. We know our lifestyle is contributing to it, right? So if we plan properly with the right education and the right incentives, some of them a little forced, some of them, like in some places, if you are an employee and you don't get your screening done, your salary could even be stopped.
Prof.
Oh yeah, and it's not because it's because it is in the interest of the company to make sure that you get these screens, right? Because if you get sick and they need to replace you, you can imagine how much money the company has to spend.
It will cost more.
Yes, to train, new Meanwhile, if you went to the clinic, it would have cost you maybe 50 cedis or 100 cedis to get screened, right? So it's sometimes you have to use, some measures to make sure that people are doing what they have to do. This is because these diseases are not, people usually don't have symptoms, right? People usually are not going to wake up one day and say, I'm going to get my blood pressure or my blood sugar checked, right?
Something must force them to.
Exactly. So either the symptoms, which usually come when it is too late, or somebody, either an employee or the employer or the government or a family member, sort of prodding them to go and get themselves checked. So that is kind of where that is the difficulty with NCDs.
It's 9:20 by the studio clock. Professor George Boateng Kyei is joining us, and he's recommending that employers should take this up. That if you don't check, we'll seize your salary until you check. Let's come to the NCDs themselves. So, what are the risk factors that cause these?
Yes. So the NCDs again is not one disease or one entity. So I think later on, hopefully, we can go through them one by one.
Exactly. Yeah.
But today we are just doing an overview.
Exactly.
So the commonest one in Ghana is high blood pressure or hypertension, followed by type 2 diabetes, heart disease, which when we say heart disease, a multiplicity of things, so we call it coronary artery disease or, heart attack and all those. And then cancers, multiple cancers. The commonest cancer among women in Ghana is breast cancer, followed by, cervical cancer. The commonest among men in terms of cancer is liver cancer, followed by others, and then also prostate cancer. So it's a multiplicity of things. Now, when it comes to the risk factors, most of the time, there are genetic risk factors and there are the environmental risk factors. Now, your genetics is your genetics. But then the environment plays a key role also. So for instance, if let's say your mother and your father has high blood pressure, the likelihood that you have high blood pressure is high. However, you can delay when your blood pressure comes, or you can even modify your lifestyle such that you may never get it. Although you have the genetic predisposition, what you do with your lifestyle, what you do with your environment, right, in terms of alcohol, so some of the risk factors include excessive consumption of alcohol. Some of the risk factors, inactivity is a big one. These days, formerly our ancestors, they would eat, a huge meal in the morning, and then they go to the farm. When I was a kid, growing up in the village, we go to the farm, we walk like 7 miles in, 7 miles out, right? So even no matter what you eat, it's all burnt, right? But today, what do? You wake up, you eat, you come out of your house, you sit in the car, you drive, sitting in traffic, and then you get out of your car, you go to the office, you sit again for 8 hours, you sit again back into your car, you go and then you sit again to watch TV. So you are completely, not having any activity, right? So inactivity is one of the big ones. That is a risk factor for all of them. And then, of course, we have to make sure that, we are reducing our consumption of alcohol, and making sure that we're also eating balanced diet. So all of these factors. So diet is one, alcohol is another, smoking is a big one, and then inactivity is a big one as well. So these are some of the key ones that are environmental risk factors that we can modify, to help us to prevent or at least delay the onset of some of these.
What role does stress play in NCDs?
So stress is kind of interesting because the studies show that, yes, increased stress could, for instance, increase your blood pressure. But again, you should have, the predisposition already. Of course, less stress is always good, for you, So, but stress, especially those of us in the big cities, is hard to avoid, right? It's like you sit in traffic, that's very stressful, and so on and so forth. But definitely, stress reduction is also an important thing to do to reduce your risk.
Okay, so we are talking about the fact that a person can naturally be predisposed by genetics.
Correct.
That is what somebody said. You got the wrong end of the genetic bargain.
Yeah.
How do you manage it? If your dad died of this or your mom died of this, what do you do?
Okay, let me give my personal example. So let's say my dad, he died at 81. He was diagnosed with high blood pressure in his 40s, right? And diabetes in his 40s. But he was very disciplined and, was able to control these, until he died, right? Now I know that I am at risk.
Okay.
So what do I do? Now, my goal is to delay the onset as much as possible. Okay. So now I'm over 50, and thankfully none of them, I don't have any of those, right? So at least I beat him to that, right?
Okay.
Yeah, so my goal is, okay, maybe if I get it at 70, by then I'll have maybe 10 years to live or whatever, right? Okay. But the key is to know what lifestyle modification can you make to delay, right? And then exercise. Exercise is really, really critical because the exercise helps in all of the NCDs, preventing all of them, including cancers, right? So exercise is very critical in terms of getting some activity in, every day. And then alcohol, right? So why
is alcohol such a big deal?
It's such a big deal because it is a drug that affects every organ in the body.
Wow.
And negatively, not positively. I mean, it's a drug that affects every organ. It can, give you liver cancer or liver cirrhosis, which will lead to cancer. It can cause what you call cardiomyopathy, where it makes your heart not being able to pump. It can affect your kidneys. So it can affect almost every organ. So that is why it's such a big deal. And, in Ghana, sometimes we don't think about it, bitters, right? So, and the bitters, maybe it may have some herbs in it, but at the end of the day, if alcohol is the base, then you are taking too much alcohol, right? So we need to think about those kinds of habits, So, and previously, the thought in the medical field was that maybe a little bit of alcohol may be useful, but the latest research says that no amount of alcohol is really useful for your metabolism or for your body, So if you can stop it completely, that is better for you. And you should know what contains alcohol. It's not only going to drink beer, but that bitters that you are drinking, how much alcohol is in it, right? So that is a big one, and then smoking. So then you are predisposed to high blood pressure or diabetes. Then don't smoke, right? Because if you smoke, that is going to increase your risk, So if you go by these lifestyle measures, then you can delay the onset, or you may even escape completely from getting it, even though you have the genetic predisposition. In other words, the predisposition is not like, it doesn't guarantee that you will get it, if you make some good lifestyle modifications. But let me also just add that even if you get these diseases, right, especially high blood pressure, diabetes, they are controllable. You see, that is, for me, I think that is where the key is, right? Even if your blood pressure is already high, I always tell patients that there's good news about high blood pressure, because if you control it, you can pretty much live your normal lifespan that God has given you. Yes, but a lot of people, they take the medicine in a few weeks and then they stop. The problem with high blood pressure is, it doesn't go away. I don't care whether you've gone to a prayer camp and somebody has told you that, it has been cured. It doesn't get cured. Okay, so you need to control it with the medication that your doctor will give you. And if you do that, you will live your normal lifespan, But if you don't, then of course all the complications can come in.
So could we say that, let's still handle alcohol.
Yeah.
The heavy drinking is what is causing or is adding to our NCDs rise in this country?
Well, I mean, I don't have numbers on, how many of us drink heavily. And
23% is said to take, and then 2.1 are said to be heavy.
Yeah. So 23% is a lot, right? Okay. So if, and yes, that would definitely drive up the numbers in terms of high blood pressure, in terms of even obesity, in terms of all the other NCDs, in terms of cancers, right? The number one cancer in men is liver cancer for a reason. One of the reasons is alcohol. So alcohol is known to cause liver cancer. That is so well known that, we call it, first you get what we call alcoholic cirrhosis. And then once the alcohol kind of fry your liver, then the cancer also comes in, right? Wow. The other causes, for instance, like hepatitis and so on, but alcohol is also a big part of causing liver cancer. So I think we need to change that culture of, daily drinking of alcohol is something that we need to change.
Weekly.
Weekly, maybe, if you're not stoning yourself to death weekly, but maybe a beer a week, is probably okay,
Okay.
But drinking every day, taking your bitters every day is not helping your health.
Early detection and screening. It's like you say, it's not normal for us. How do we help in that direction? What should we do as a nation?
I have a lot to say about it. So as a nation, we need to prioritize, these things, and screening is really key if we are going to get around, NCDs. And there are recommendations for each of these NCDs in terms of screening. So it's not like we don't know what to do. We know what works and we know what to do. The problem is the implementation or getting it done, right? So the question is, so for instance, when it comes to high blood pressure, the recommendation is if you are between 18 and 39 years old, you should get your blood pressure checked about every 3 years, which is not much, right? I mean, the pharmacy close to your house can do this for you, right? And then if you're over 40, the recommendation is get your blood pressure checked every year, right? So that, again, is not much, right? Now, the question is, how do we get people or the population to follow these guidelines? And do we have you put in place the infrastructure for this to be done, right? And the answer to my second question is, I don't think so. So I think that is where all of us, as government, as corporate bodies, as, religious bodies, all of us need to, come together and, put the measures in place to tackle this, right? So the screening is also important for diabetes, right? Because 2.4 million Ghanaians are living with diabetes, right? Which is like 7.5% of the population, which is a lot, right? And a lot of people don't even know that they have diabetes until they end up in the hospital with a coma. Okay, so but if they went and got screened, they could have even changed their lifestyle to prevent even the diabetes from developing, right? So the question is, how do we get people to I think we should all get on board. So government should prioritize this and make sure that it is friendly in our various clinics. So in the various clinics that we have, you can have like a screening room. Because the thing is, I don't want to go to a clinic and wait for 4 or 5 hours when I know I'm not sick to get my blood pressure checked, right? Anytime you want people to do things, I always tell people that, look, if you want people to do things, make it easy for them to do it, right? So you want people to get screened, and then yet they have to go and wait for 4 hours or wait for the whole day just to get their blood pressure checked. The stress alone will increase their blood pressure, right? But if they know that, I can just walk in and 10 minutes, my blood pressure has been checked and I'm on my way, the person is probably more likely to do it. So we can have these, places in our communities where I know that if on Saturday I'm relaxing at home, if I walk for 5 minutes, there's this place that I can go and get my blood pressure and my blood sugar checked. Then you can do that. Or I know that at my workplace, if I walk in to the nurse at the workplace, they can have all my checks done for me. You can do that. I know that at the market where I work, there is this place set up by the government or by the association where I can go and get, these checked. Or again, at the lorry station, I can pass by and get. So we need to think a little bit outside the usual health system. But I don't think the usual health system is set up for us to do massive screening of the population that we must do. So we have to use all the areas that are available to us to be able to get as many people as possible screened. And also, education is a key one, right? So what we are doing right now, and a station like Z that is interested in lifestyle, this is something that we need to educate the public about, because I'm sure maybe after this program, some people will go and get their blood pressure checked.
I am thinking I should.
Okay.
Yeah, I mean,
Yeah.
this interview is pushing me to right after this show.
Yeah.
I should get to the nearest. I'll go with my DJ. He doesn't look like he's checked.
Yeah. So go with your DJ. Go down. There's a pharmacy just down the road. They will check your blood pressure for you if you haven't gotten it checked. In the past few years. So that is something that we all need to get involved in, and as we educate the public, I think that it can catch on, and once it catches on, I believe that we can prevent a lot of unnecessary deaths.
What would a typical setup be in terms of structure-wise? What would be inside that would say will be sufficient enough to sort out a chunk of these NCDs when it comes to the screening? Yeah, what would be inside?
So apart from the cancers, which usually the screening is a little technical, when it comes to the big ones, diabetes and hypertension and heart disease, you don't actually need much. So you can have like a room that is like 2 meters by 2 meters. All you need is a scale that will weigh the person, a cuff, a blood pressure cuff, right? And then a machine like that will prick your finger and check your blood sugar.
That's all.
That's it.
And a medical person will be in there. A nurse.
And maybe a nurse will be in there. That's it. So it's not like it doesn't take a huge investment, right? But the payoff is massive.
So we could get one of these, I don't know what we'll call them, health screening booths.
Yeah. Mm-hmm.
Let's call them health screening booths.
Yeah.
We could have one in every constituency.
Oh, not constituency. You can have one in every village, every, corner, it's not like it's just that the village itself can have its own, can pay for it by itself. It's not like a lot of money, right? Because like if you buy, let's say, a blood glucose check machine, you can use it to screen, hundreds or thousands of people. All you need is the strips, which cost a bit of money. But, if we put our minds to it and we pay for the strips, we should be able to get a lot of people screened. Yeah, wow. That's for blood sugar.
So ZFM could actually partner maybe one of these agencies, and then we have health screening booths all over the country.
We could, yeah.
Branded ZFM.
Yeah, ZNCDs or whatever.
Yeah, something like that.
So, why not? Because and I always say that it's in the interest of corporate Ghana to take interest in this, right? It's in their interest because, if you don't take interest in this and all your young people, it's not uncommon now in the hospital for us to have people in their 30s coming with a brain bleed.
What is that, if you could share some light on that?
A brain bleed is like the blood vessels in your brain has popped and there's blood everywhere inside the brain. So
and it's caused by?
It's caused by high blood pressure most of the time. Yeah. And it's because this 35 or 40-year-old person, they didn't know they have high blood pressure. They were going about their business. One day they get a stroke. They come to the hospital, you do the scan, a bunch of blood in the brain, right? And this is because they did not know they have high blood pressure. If they had just, a month before, 2 months before, had gone to a place to get their blood pressure checked and prescribed some medications, that would have been prevented, right? So if the person doesn't die, the costs of caring for them now that they have a stroke is massive, massive cost, right?
Wow.
So it makes a lot of sense for us to prioritize the screening because that can save a lot of lives. Okay, so I agree with you. It doesn't take much, and I think we just need to put our minds to it that we want to do this. Corporate Ghana needs to get involved and get they have a lot of power. So
exactly.
So they can have policies that make sure that their employees are screened every year.
Wow.
Okay. Or our employees are up to date on their screening. Okay. So you're up to date on your high blood pressure screening. You're up to date on your diabetes screening. You're up to date on your cancer screening. So if you're a woman and you're over 40, a mammogram is recommended every few years. So you are, up to date on that. You're up to date on cervical cancer screening, which is the second common cause of cancer death among women in Ghana, which is a shame because cervical cancer have almost been eliminated in the developed countries.
And we are still struggling with it.
Yeah, because 90% of cervical cancer deaths happen in Africa. And, the reason is that we don't have enough resources, or we have not allocated enough resources to do the screening. But now new technologies for screening has come, that we can easily take advantage of. So maybe later on we'll talk about cervical cancer and I can go into detail, but new technologies have come that we can take advantage of. So you have, so if you make sure that your employees have all gone through their screening, you are sure that you have a healthy workforce that will work for you until their retirement. And that will not cost you a lot of money in medical bills and insurance payments and so on, So it's in the interest of the government to do this because you need a healthy population. Without a healthy population, who is going to pay the taxes, right? To get things done for all of us, to fix our roads and to fix all the things that we need fixed. So it's in everybody's interest to get on board.
So how can you spoke about technology, because that was bringing me to my next question. How can technology and digital health innovations be leveraged to prevent and manage NCDs?
So a lot, actually. So this is a huge area, and I think we should take advantage of it with AI and all of that now. But even with common cell phones, right? So, for instance, one of the things, I'll just give two examples. Now, so one of the difficulties is that people who feel they are not sick go into the hospital, right? So now there's a company, for instance, that is partnering with UGMC using a digital platform where the person checks their blood sugar, check their, you can check your blood sugar at home anyway. You can also check your blood pressure at home. The machines are sold in every pharmacy in Ghana. And for those of us, it may be expensive for, those in who are not in the middle class. But for you and I, that machine can be bought. It's not that expensive, right? So they check their blood pressure, and then it's transmitted to this app, and the doctors can see it, and then the doctor can consult remotely with the person, and okay, you need to adjust your medicine this way, you need to do this way. So that is a way. You can also use reminders for people to take their medications, use reminders, digital reminders for people. And now even diagnosing, let's say, cervical cancer lesions, there's now artificial intelligence that could potentially be used, such that and we are doing some research on this, and maybe later I'll come and talk a bit more about it, but you can have a nurse in the village who will take a picture of the cervix, and then it gets uploaded onto an AI platform that will tell the nurse, what they are seeing or what the diagnosis is and what to do about it. So AI and technology can be leveraged massively, to help us kind of catch up in terms of our screening and all of that.
What did the West do well to get rid of this cervical cancer thing? I'm interested in that. What did they do?
Well, what they did is they screened. So
wow.
They screened. So cervical cancer is a little different because the cause is actually a virus.
Oh, it's not genetic?
Not necessarily genetic. The cause is a virus called human papilloma virus that is transmitted early to the woman when they start being sexually active. So maybe they are 16 or something, they get sexually active. This HPV virus is transmitted to them. The virus go and sits in the cervix, and then gradually to cause the cancer when the person is maybe around 40, 50 years old. So you can screen. There's something called pap smear, where you go and then the gynecologist will take a sample on the cervix and then take it to the lab, and then pathologists will read it and then see whether there are early lesions that need to be taken care of. So that is what the West countries have done it. The problem is that we don't have enough pathologists or enough gynecologists to be able to screen everybody with a pap smear. So we need to come up with new ways of doing it. And luckily, there are new technologies now where you can train nurses. There's a nurse in every hospital, there's a nurse in every clinic. You can train nurses to use these handheld machines that they can use to look at the service. And then they can make the diagnosis. They can even treat the early lesions. We are doing a research on it at the moment among women who are living with HIV. So the other thing about cervical cancer, there's actually a vaccine for it.
Oh.
Yes, so there's a vaccine for it. And I think Ghana, the latest I know is that we are trying to roll out a vaccine program. The vaccine has been around for, more than a decade. And in the developed world, every child, at least every girl who is 9 to 12 years old is vaccinated. Once you are vaccinated, you cannot get the virus that will cause cervical cancer. So, over time, to be eliminated. But we have not started rolling out the vaccine yet. But it's available in the country, though. So, if you have 9 to 12-year-old girls in your house, you can go to the pharmacy, get a vaccine for your children. It's a little expensive, but I think it's worth it. Definitely worth it. But I think the government is working hard to roll out a national program. A lot of countries in Southern Africa have done that. And in West Africa, I think Nigeria has started the most massive program for vaccination. I think we should follow suit.
Wow. If you heard Professor George Boateng Kyei saying we have done enough research, we're doing research, it's also because he is the Director of Medical and Scientific Research at the UGMC, right? So
Yes.
that is why you hear a lot of the research. But he's also a consultant physician with the Noguchi Memorial Institute for Medical Research, UG. So research is his thing, and he's blowing our mind. But let me remind you, he said that your salary should be tied to your screening. That if you've not screened, don't expect a salary this month. This message goes out to all workers of Z Multimedia from my very good self. Okay, how can community-based initiatives create the kind of awareness and the public campaigns that we need? Communities, what should they do?
Yeah, so this is actually something that could be done by communities, right? So we have the district assembly, we have the local rep. When I go to my village, there is a local rep who is a distant cousin, and he's always asking for money from me to, to do some local initiatives.
Okay.
He's very active. So I think that every village led by the district assembly can have like a screening point, right, where you go and get screen, at least for high blood pressure and diabetes, the simple ones, because those two are also the big ones.
Okay.
And those two also lead to the other NCDs. So for instance, if you have high blood pressure, then it can lead to kidney failure, it can lead to heart failure, it can lead to heart attack, it can lead to stroke. So that one high blood pressure, if you are able to control it, it will control a lot of the other NCDs.
Oh, okay.
Right. So something like that. And it doesn't take much to check your blood pressure. It's just a blood pressure cuff they put on your arm. 2 minutes is done. You know your numbers, and then you know whether you need to take medication or not. So this is something that every village can say that, okay, we can even, you don't even need to build new infrastructure. The village can designate the chemical seller over there, give them some allowance, and say that everybody who comes to screen, maybe the district assembly will pay you 1 cedi or 2 cedis or whatever, And, something like this could be done. I think we need to start thinking, because I don't think we should, as somebody in my village, to take a car and travel 15, 20 miles to go to the next district hospital, to go and wait for 7 hours.
When he or she is not sick.
Exactly, when she was not sick. Think about it. Most people will not do that.
They won't do it.
Yeah, they won't do it. So you need to bring the thing to where they live and where they can say that, when I go to Kofi Mensah's shop, I'm going there to get my blood pressure checked. And that will be easy for all of us. But we need to put the resources in, put some incentives in. That pharmacist or that chemical seller that is checking their blood pressure, they need to be trained, right? And then they need to be they need to have some incentive. And I don't think it will be much.
I'm still thinking of the campaign. We should partner Z Multimedia. Z should partner one of these organizations, get some funding, and get boots all around with our purple Z branded all over the place.
That would be great. And you'll be doing a huge service for our country, because I think we all need to really, the media need to take interest in this. It's not only politics, I think we've talked politics enough. And, really it doesn't bring a lot of tangible benefits to the population. But if your station focuses on these lifestyle and lifestyle changes, I think that will bring tangible benefits to all of us.
Because think of it, assuming every trotro station has one.
Mm-hmm. Yeah. Mm-hmm.
So whilst you are in line waiting for your bus, your trotro, your taxi,
you just pass by.
Check.
2 minutes, you check your blood pressure. If you decide, they'll advise you to go to the pharmacy or to go and see your doctor. If it is low, if it's normal, you know that, you can come and check again in 2 years' time or in a year's time if you're over 40.
It's something that Z will carry it up. So, Prof, before we have about 9 minutes to the top of the hour, what is the relevance of lifestyle to the businessman, business community, and entire business ecosystem? Lifestyle.
So, lifestyle is key because most of these NCDs are, in a way, lifestyle diseases.
Okay.
Yeah, they are lifestyle diseases. Fine.
What does that mean?
Well, what that means is that how you live your life will determine, for the most part, whether you get these and whether you'll be able to control them well. So, if you do not exercise, right? You drink a lot of alcohol, you smoke. These are all lifestyle things. And those lifestyle things, right, can lead to you having heart disease or high blood pressure or kidney failure, right? So lifestyle is key. And I think, again, I've worked in places in the US where if you smoke and you don't quit, they won't pay for your health insurance.
Oh, wow.
Oh, yeah. So, of course, everybody quits. So some of these things, we need to start talking about it. I know it sounds controversial, and I don't shy away from controversies, because we need to start talking about some of these things and see how we can fashion it to fit our own community, right? So lifestyle is key. Exercise is key, right? So if, as a corporate body, we want people to come to work early. We know there's traffic in Accra. Do you have a gym on site where maybe people can work out before they leave for home? If we have that, people are more likely to, they finish at 4:30, they go and work out for 30 minutes or 45 minutes before they join the traffic, right? But if we don't, then people will not do it. By the time they get home, they are already tired. They have no desire to go for a 30-minute walk or to, jump on the treadmill or go to the gym, right? But if we can make it easy for them, some people may even come early to work just to come and work out, before they start work, right? So all those are things that we can do. We can help the lifestyle of our employees to do the right lifestyle.
Chief Executive, so please speak to the Chief
Standing desk, right? So sitting is what we say sitting is the new smoking. In other words, when you sit 8 hours a day, your risk for cardiovascular disease jumps through the roof.
8 hours a day?
Yes, or even 4 hours. Your risk of cardiovascular disease jumps through the roof. So you are in the office or you are the CEO, you have an office, you want people to work. What can you do about it? You can get them standing desks. Right? So you can have a desk where I have one in my office where, like, when you come, because I do a lot of research, I write a lot, which means, I have to sit.
You would have sat a lot.
Yes. So you can stand and then work, and that reduces your risk of heart disease and all the other things that sitting can bring to you.
The same desk is adjustable into a standing position.
Yes. So you can do that. Or you can have a small platform that you can lift up to the face level, that you can put your laptop or whatever on, and work. So those are things that we can do to help, our employees to make sure that they are being healthy as corporate. Apart from all the other things we talk about in terms of encouraging them to do their screening, encouraging them to stop smoking, and encouraging them to go to keep with their medications.
So if you have a company that they sit a lot, you can put a timer into the system where at certain times it will beep. Somebody get up and walk around.
Get up and so like you can use technology. I mean, a lot of us wear these phones. Wear these watches. Mm-hmm. You can set these watches like mine. Actually, I think it's already set. It says time to stand because I've been sitting here for almost an hour now. So it's time to stand. So if I was in the office, it's time for me to stand and go and walk around for about 5 minutes and then come back. Right.
Amazing.
So things like that could be used, to help us to be mindful, because sometimes you are deep into the work and you forget that, you need to get up.
Okay, to all the chief executives that were at the CEO summit yesterday, including the vice, the former president and former vice, and the current vice, both party bigwigs going. This is the verdict from the good professor. He says lifestyle is a critical component of business and increased productivity. So they should support. They should put in place the right measures and the policies to help the lifestyle of the average Ghanaian. Professor George Boateng Kyei, Director of Medical and Scientific Research, Directorate of UGMC. He was talking to us. I'll ask him his final words, but I need to also add that he's also the consultant physician, Noguchi Memorial Institute for Medical Research of UG. We're talking non-communicable diseases, why everyone should be concerned on Health and Wellness Tuesdays. Prof, any last words?
Yeah, my last word is that, if you are listening and you haven't checked your blood pressure in the last year or two, you haven't checked your blood sugar in the last year or two, please get it checked. Go to your nearest pharmacy. They'll be able to help you to get these things checked. And if you check it and you need to see a doctor, please do. And because these things can be controlled. It's not a life sentence when you know. It's better to know and control them. If you control them, you can live the lifespan that God has given you. But if you ignore them, then definitely you go earlier, you become disabled. And, we don't want that for your family or for Ghana.
Okay. Those were the words of the prof. Thank you so much, people, for joining us. It's a Tuesday morning, Health and Wellness.